Hi, it's Dr. Centeno, and I'd like to talk to you about outside ankle pain because oftentimes there are common issues here that get missed by most doctors. So a patient I saw today has left outside ankle pain that really came on kind of suddenly, but there was no injury about 2 or 3 months ago. He's a very active guy. And he plays rec hockey and lacrosse and recalls no injuries, but he may have gotten injuries through the years, and he's got pain on the outside above the ankle, just above the ankle. Now, his problem, once we found it, I can tell you would be all but invisible to the average family doctor, podiatrist, or orthopedic surgeon. Why? It's a subtle ligament issue that required stress ultrasound imaging to diagnose. So what does that look like?
And
You can see me using an ultrasound probe there. I am looking at these ankle ligaments while I stress them. And in this case, his ligaments were all screwed up. They were too loose. He had multiple partial tears in that ligament. Now, that's not a surgical thing at all. So basically, I was looking at these outside ankle ligaments that are here and here and here and here and here. And those were loose, which allowed this little fibula bone to move way too much, thus causing the pain. So again, his pain was because the outside ankle bone was moving on the main ankle bone. And this issue is often missed by MRI scans of the ankle. And how do you fix it? A precise high-dose PRP injection using ultrasound guidance into those lax ligaments. Then you recheck with a stress ultrasound in 2 months, and most patients usually need 1 to 3 treatments. So for more information and to find a doctor who knows how to do this and knows how to find this, see regenerative.com. Thanks so much and have a great day.